Project 2025 outlines a plan to undermine America's system of checks and balances in favor of advancing an extreme far-right agenda that would harm all Americans. The proposal seeks to shift power away from the public and grant greater control to politicians, judges, and corporations, giving them more influence over people's daily lives. Here's how Project 2025 could specifically impact residents of Hawaii. Taxes. The plan reallocates the tax burden, shifting it from the wealthy to the middle class. For a typical family of 4 in Hawaii, this would result in a tax hike of $2,412 annually. Meanwhile, 45,000 U.S. households earning over $10 million would each receive an average tax cut of $1.5 million per year. Social Security. Project 2025 supports raising the Social Security retirement age, which would affect around 71% of Hawaii residents, approximately 1,022,204 people. The latest Republican Study Committee budget proposals suggest increasing the retirement age from 67 to 69, which could lower benefits by $4,100 to $8,900 in the first year, depending on when benefits are claimed. Healthcare. Project 2025 proposes imposing lifetime limits or caps on Medicaid benefits, potentially affecting 57,800 low-income Medicaid recipients in Hawaii. The plan also eliminates out-of-pocket limits for prescription drugs under Medicare, which would increase costs for up to 82,130 people in Hawaii. It also prevents the government from negotiating lower drug prices. Abortion rights and contraception. The proposal would remove certain emergency contraception medications from free preventive care, meaning 193,000 women in Hawaii would lose access to free emergency contraception. It also directs the U.S. Department of Justice to misuse the Comstock Act, laws from 1873 and 1909, to criminalize the mailing of medication abortions, effectively instituting a nationwide ban on abortion, even in states where abortion is still legal. The plan further instructs the Department of Justice to take legal action against local officials who refuse to prosecute women and doctors violating state abortion bans. Child care. Project 2025 calls for the elimination of the Head Start program, which currently provides free child care and other services to 2,865 low-income children in Hawaii. This would reduce access to essential child care in rural and underserved communities where such services are already scarce. Student loans. The plan replaces income-driven repayment (IDR) programs with a single, uniform repayment system, resulting in higher payments for those already enrolled in IDR plans, including the Biden-Harris administration's Saving on a Valuable Education (SAVE) plan. As a result, 19,400 borrowers in Hawaii currently enrolled in SAVE would pay an additional $2,700 to $4,100 annually. Public education. Project 2025 proposes eliminating the U.S. Department of Education and discontinuing Title I funding, which supports schools that serve low-income students. This would lead to the loss of 718 teaching positions in Hawaii, affecting 10,192 students. Project 2025 represents a significant policy shift that would disproportionately harm vulnerable populations, especially in Hawaii.